National Association of Palliative Care for Ayush and Integrative Medicine focuses attention on integration of palliative care with Ayush streams of medicine. Now, I would like to share with you the presentation prepared by Drs. P. Satyarajeshwaran, Assistant Director in Charge, Siddha Central Research Institute, Chennai, Ministry of Ayush, Government of India. He is also President of Tamil Nadu State Chapter of National Association of Palliative Care for Ayush and Integrative Medicine. What is the role of Siddha medicine in alleviating pain in end-stage disease patients? Siddha is one of the ancient medical systems in India, considered as the mother medicine of ancient Tamils and Dravidians in South India. The word Siddha means accomplishment. The Siddha system is a paragon of undisclosed perception, embodying the results of the ancient wisdom of ancient Siddhas. This civilization dates back to 12,000 years BC, evinced by findings of historians and the Tamil literary works such as Tolpagyam, Tiruvasagam, etc. Before 2000 years, the traditional medical system of the Tamils was known as Marundu or medicine. A Siddha has also been defined to refer to one who has attained Siddhi. The Siddhis as paranormal abilities are considered emergent abilities of an individual that is on the path to Siddhahood and do not define a Siddha who is established in the Pranav, the Om, which is the spiritual substrate of creation. The persons who were associated with establishing such a Siddha school of thought were known as Siddhas. Siddhas were upright people and mystics who acquired supernatural powers. What are the goals of treatment in Siddha stream of medicine? The inherent principle of palliative care is an integration of support system with the primary focus to alleviate suffering and provide emotional and spiritual assistance. The ultimate goal is to establish a strong foundation of comprehension regarding the diagnosis and offer treatments that promote comfort and improve quality of life. Today, supportive and palliative care has been recognized as an important component of quality of life of the care for patients, particularly those with advanced or incurable disease such as cancer. The goal of palliative care should continue to focus on the relief, suffering and the improvement of the quality of life for patients with advanced illnesses such as cancer. Care for ethical issues associated with this treatment strategy, such as particular methods of pain relief, a reliable assessment of suffering, autonomy and multi-specialist care. While these principles are important to increase and improve the network of palliative care, the resource-poor Indian environments present numerous barriers for these principles to be practically applied. What are the challenges with regard to integration of Siddha with palliative care? Main challenge exists with limited clinical trials, as many of the patients will be excluded in major trials tried earlier due to ethics. Lack of drug or drug-food interaction, customized dose fixation, lack of permission for rational usage of pain management drugs mentioned in Siddha. Where we are in palliative care, there is always a growing interest towards Ayush therapies that have been variably called traditional medicine. Ayush therapies are used as a mainstream therapy or as add-on to standard therapy. The term integrative therapy is chosen to describe the combination of Ayush therapies with standard therapy. The aim of integrating Ayush Siddha facilitates holistic care. Holistic healing not only helps the patient but also the family and caregivers, as they will be given solace in end of life care. Body and mind soul concept of Siddha helps in increasing quality of life of the patient and family. This will provide autonomy to the patient and also bridges the hypothetical gap and mind barriers between different caregivers, as they mutually help each other to give an appropriate care to the patient. Low blood counts. Chemotherapy. Chemotherapy drugs can damage bone marrow. Bone marrow makes blood cells which grow rapidly, making them very sensitive to the effects of chemotherapy. Chemotherapy kills many other cells in bone marrow, but the cells recover within time. Specific chemotherapy treatment and dose will put you at risk of low blood cells counts. Radiation therapy. Radiation therapy to large areas of your body and especially to the large bones that contain the most bone marrow, such as your pelvis, legs and torso, experience low levels of red and white blood cells. A detailed diagrammatic representation is given on the right hand. What is anemia? A disorder characterized by a reduction in the amount of hemoglobin in 100 ml of blood. Signs and symptoms of anemia may include pallor of the skin and mucous membranes, shortness of breath, palpitations of the heart, soft systolic murmurs, lethargy and fatigability. Veluppu Noi is one among the diseases classified based on the symptoms, which literally means the pallor that can be exactly correlated with modern classification of anemia. So, normal and anemic cells are seen on the right side. What is thrombocytopenia? Kurutiyazhal. Bleeding. Low numbers of platelets in your blood can cause bleeding. You might bleed excessively from a small cut or bleed spontaneously from your nose or gums. Dangerous internal bleeding can occur. A low platelet count can delay your treatment. You may have to wait until your platelet levels go up in order to continue with chemotherapy or to have surgery. Neutropenia, that is nadir. White blood cells are part of our body's immune system working to protect us against infection. A neutrophil is one type of WPC. Then they make up the majority of WBCs. They are the first responders and quickly appear at the site of infection, ingesting and destroying foreign particles. They can be found in the pulse of a wound and play a role in acute inflammation, redness, warmth, swelling and pain. A normal neutrophil count, also called absolute neutrophil count or ANC, is between 2500 and 6000. A low neutrophil count less than 1000 is known as neutropenia. The lower the neutrophil count, the higher the risk of infection. Neutropenia is most often caused by cancer therapies including chemotherapy and radiation therapy. For chemotherapy, low counts usually occur 7 to 12 days after treatment. So, the intervention of Siddha medication. Madudalai Manapagu. So, details are given, grade 1, grade 2 and grade 3. Anabedi Chanduram. What are the effect of the drug on hemoglobin level is seen on graph 1 and the effect of the drug on serum ferritin is seen on the right side. What's a burden? Anemia is one of the most common hematologic complications of cancer and cytotoxic treatment. The economic burden associated with anemia in patients with malignancy has been extensively studied. Mean 6-month expenditure for the average anemic patient receiving chemotherapy was $50,209. Siddha medication, thrombocytopenia, grade 1 and 2, Adadodai Kargam, Adadodai Kudineer, Nilavembu Kudineer, grade 3, Tangabarpam, radiation protective potentiality of Athadoda Vasiga. These are the details given. Siddha medication, neutropenia, Amukkara Churnam is the drug of choice in Siddha after cancer therapy. Has also enormous potentials as immunomodulator. What is the role of Siddha? Siddha system is useful to alleviate the chemotherapy, radiotherapy induced gastrointestinal mucositis up to grade 4. To offer a cost effective management, can be safely integrated with other medical systems. Grade 1, symptomatic or mild symptoms, intervention not indicated. Moderate pain, grade 2, not interfering with oral intake, modified diet indicated. And grade 3, severe pain interfering with oral intake. Grade 4, life threatening consequences, age intervention indicated. And grade 5, death. Evidence. Honey has also a role in preventing or reducing the severity of mucositis associated with cancer treatment. Evidence is limited. Further control RCT is must. So, a reference is already given. The turmeric triphala oral rinse product, designed and developed based on traditional wisdom, validated through rigorous scientific research, was found to be safe and effective in treatment of cancer, chemo and radiotherapy induced oral mucositis, fulfilling an unmet need in comprehensive cancer care. Clinical application of the Susruta. Principle of management. Oral mucositis is described as akkaram. Chemotherapy induced oral mucositis is described under metallic drug toxicity chapter. Chemoradiotherapy elevates pittam. We aim to reduce pittam by external and internal drugs. So, World Health Organization has given an oral toxicity scale. Grade 1 is soreness, grade 2 erythema ulcers, grade 3 ulcers with extensive erythema, grade 4 mucositis to the extent that elimination is not possible. Goals of treatment: reduction of pain, inflammation and restoring functions, prevention and treatment of secondary infection, healing of mucosal ulcers, restoration of GUT microflora to improve digestion and absorption of food. Challenges with integration: drug herb interaction is not studied. No scientific studies to say that the chemotherapy, radiotherapy efficacy is not compromised. Lack of clinical study reports. We have got evidences. Siddha in non-healing ulcers, a case study made by Dr. Samraj Karnanidhi. He is also one of our founder life members of NAPC AM. He has given an abstract on effectiveness topical application of Siddha medicine for chronic non-healing lower extremity ulcer. Evidence: a chronic ulcer is that which does not heal within 3 months. Diabetic, arterial and venous ulcers are the common cause for non-healing lower extremity ulcers. The prevalence of chronic leg ulcers is 0.6 to 3% in people over 60 years and 5% in those over 80 years. Here we report a case series of 6 patients with chronic non-healing ulcers. All the 6 patients received topical application of Siddha medicine leg ulcer measurement tool. Scoring system was used to assess the severity, prognosis and for follow-up treatment. After the 6 weeks of treatment, 33% have ulcer size more than 5 centimeters, 16% have exudate their ulcers, none of them have necrotic tissues, leg edema and peri-ulcer affected skin in their ulcers. It was found that the patients treated with Siddha medicine have satisfactory improvement in the non-healing lower extremity ulcers. So, the details are given in these pictures. Healing. According to Hippocrates, healing is a matter of time, but it is sometimes also a matter of opportunity. After 6 weeks of treatment, MTP treated patients were found to have satisfactory healing against chronic non-healing lower extremity ulcers compared with the other 2 groups of medicine. The quality of life was satisfactory for all the patients involved in the study. There is another abstract, role of Varmam in mental disorder, given by Dr. G. Revati. Similarly, Rasagandhi Medugu in squamous cell carcinoma is another excellent abstract given by Veda Merlin Kumari and Manika Vasagam. So, the take home message would be entrepreneur and expert. Thank you.